Okay, just a quick heart review. So let's start in the body, and I'll get you guys to help me. So if we're up here in the body, so it's our cells have got their oxygen and their nutrients, so is our blood coming back to the heart, is it high in oxygen or low in oxygen? Low in oxygen. So coming back, it's going to be low in oxygen, and it's coming back into the right or the left side of the heart? Right side of the heart, in through these guys, which are, yeah, superior and inferior vena cava. So if you like numbers, we can stick some numbers on there. Okay, so those are the largest veins in the body, and so we'll talk more about veins and arteries. It won't take long. It's not, once we go over it, it's okay. Right, arteries go away from the heart. Yes. All right, so into the right side of the heart. So first stop is in this guy, which is an atrium. Yes, and so let's remember this is right and left, because that's going to be important if you were to label things, okay? Chambers. So there's 4 chambers of the heart. So the first stop is this right atrium up here. So we're still low, low oxygen in this right atrium. Okay, so this atrium squeezes, and where does it put the blood? Into the right ventricle, yes, through this valve. Into the right ventricle. So the ventricles are bigger because they are pumping blood outside of the heart. The atriums are a bit smaller and not as strong because they only have to pump into the ventricles. Okay, so where does the right ventricle pump blood into? Pulmonary arteries. So we're coming up here into these pulmonary arteries. And where is it going to? Yes, to the lungs. Yeah, so that would be your left lung and your right lung. And so our next unit is the respiratory unit. Oh yeah, that's fine. We'll learn what happens in there exactly, but essentially it's going to pick up oxygen. So it's now high O2. So it's going to leave the lungs and re-enter the heart via, what's this guy called? Does anybody remember? Pulmonary veins, yeah. So let's give this number 6, into these pulmonary veins. So this high oxygenated blood from the lungs comes into the right side or the left side of the heart. We only have one left. The left side of the heart, so into the left atrium. And when those atrium contract and push blood into the left ventricle. And that left ventricle is the strongest chamber because it has to pump where? Into the aorta, which goes to the rest of the body, yeah. So that kind of goes underneath, which can be a little tricky to get in a diagram, but loops under there. And then off to the body. All the high oxygenated blood. Okay, so it makes sense when you're talking about it, but then you look at that and you're like, what's going on? When you're talking about it, it's okay though. Okay, so I'll just talk about a couple of slides and then we'll come back and draw some blood vessels.